So today's question is 48-year-old obese female presented with right hypochondrial pain. USG abdomen showed calculi in the gallbladder. A cholecystectomy was done. Gross and microscopic image is shown. Which of the following does it represent? What is accumulated? Calcium, cholesterol, protein, glycogen. Now let's go to the history again. So it's a female with right hypochondrial pain. Where do you get Murphy's sign positive? What is Murphy's sign first? So when you're going to palpate your right hypochondrium, the patient can have pain in the right hypochondrium during inspiration. That's because your inflamed gallbladder is going to cause pain. Okay, so it's a cholecystitis, an acute cholecystitis, or it could be an acute and chronic cholecystitis. So what is shown on gross is you see multiple yellow colored stones, and in the mucosa you have some yellow specks. So usually what happens, because it's a cholecystitis, you have an inflamed gallbladder. So what happens in this inflamed gallbladder, you have all signs of inflammation, so it appears reddish. So in that you have some yellow colored accumulations. So why is this yellow color? What causes this yellow colored appearance? It's because of accumulation of foamy macrophage. So you have lot of foamy macrophages which gives a yellow colored appearance on gross. So remember, all these big yellows are stones, all these small yellows are cholesterolosis. So this microscopy is showing foamy macrophage, a large cell with a nucleus. Okay, so foamy macrophage imparts an yellow color. So because you have a red colored mucosa in which you have yellow specks, it appears like a strawberry. So this is called strawberry gallbladder, or it's called cholesterolosis of the gallbladder. So what does these macrophage contain? They contain cholesterol or cholesterol esters. Okay, so this is about cholesterolosis. So what is it? It's actually a type of lipid accumulation. So when you take lipid, it could be a triglyceride accumulation or accumulation of cholesterol or cholesterol esters. So where do you get triglyceride accumulations? In fatty change of the liver. Whereas your cholesterols can accumulate in atherosclerosis or in cholesterolosis of the gallbladder. Now tell me what's the answer. So the answer is cholesterol. So can calcium accumulate in the gallbladder? Yes or no? Yes. So what is that called? So see here, the entire wall of the gallbladder is calcified. So you have a chalky white appearance. So calcification appears as a chalky white appearance. Okay, so this we call it as a porcelain gallbladder. So why are we bothered about porcelain gallbladder? Because it increases the risk of carcinoma. Okay, so where do you get protein accumulation? Any example for protein accumulation in any part of your body? So in multiple myeloma, it's a proliferation of plasma cells. Your plasma cells will produce immunoglobulin, and there will be a lot of immunoglobulin accumulated inside the cell. You have something called Russell bodies. So Russell body is an example for protein accumulation. Okay, so where do you get accumulation of glycogen? So glycogen accumulation can occur in case of glycogen storage disorders. So I hope it is clear. Okay, so calcium accumulates and causes porcelain gallbladder, whereas when you have accumulation of cholesterol, we call it as a cholesterolosis or a strawberry gallbladder. Okay, whereas protein can accumulate in other parts of your body, so they are nothing but immunoglobulin containing cells, these Russell bodies, whereas glycogen accumulates in glycogen storage disorders. Okay, thank you.